causes numbness in the toes? If you get numbness in your toes, you may be worried about what's causing it, if it's serious, and what you can do to get the numbness to go away. Hi, I'm Dr. Dave Candy, and in this video, I'm going to tell you about 5 causes of numbness in the toes and how you can treat each of those causes. So the 5 causes of numbness in the toes are diabetic neuropathy, a plantar nerve problem, a tibial nerve problem, otherwise known as tarsal tunnel syndrome, a sciatic nerve compression, or a pinched nerve in your lower back. So the first cause, diabetic neuropathy, is the one that people most commonly think of when they hear about numbness in the toes. Diabetic neuropathy comes on when your blood sugar is elevated for long periods of time, and it damages the blood vessels, particularly the smaller vessels in your hands and your feet. And that's why diabetic neuropathy is often known as a stocking and glove pattern of numbness, because it affects the hands and the feet. It can also give you pain or burning in the hands and the feet as well. So what do you do if you have numbness in the toes because of diabetic neuropathy? Well, the obvious choice is that you want to lower your blood sugar. There are medications that help do that, like metformin and insulin, but if you're a type 2 diabetic, meaning that you do produce insulin, you're just not using it very well, you can manage a large part of that with diet and exercise and help reduce or even eliminate how much medication that you need to take to control your blood sugar. So the foods that you want to avoid, the acronym for them is CRAP foods. That stands for carbonated beverages, refined sugars and flours, artificial colors and flavorings, and processed foods. That those foods tend to either be high in sugar or have a high glycemic index where they quickly get turned into sugar and can spike your blood sugar. Conversely, you want to try to eat more GLOW foods. And what that stands for is green leafy vegetables, lean proteins, omega-3 fatty acids, and water. That eating more of those type of foods and less of the other will help you to control your blood sugar. Now, obviously, this is not a video about diet. You want to discuss your individual diet with a dietitian or nutritionist or someone who specializes in that field. But largely, if you cut some of the CRAP foods and eat more of the GLOW foods, you're going to lower your blood sugar. Now, exercise is the other part of the equation. That the more you move, you actually burn the sugar that's in your blood. That when you use energy when you're exercising, it takes the sugar that's in your blood and it converts it into energy. So the direct effect of exercise is it takes some of the sugar out of your blood. The other effect of exercise is that it improves your insulin sensitivity. So what that means is that if you're producing insulin, you're just not using it very well. Exercise actually helps improve how well the insulin that you do produce works. So those are 2 good reasons to exercise if you do have diabetic neuropathy. Now, what about the second cause of numbness in the toes? The second cause of numbness in the toes is a plantar nerve problem. And you actually have 2 plantar nerves. You have a medial plantar nerve that runs along the inside of your foot and a lateral plantar nerve that runs along the outer side of the foot. Now, both of those start out on the inner side of the foot, and we'll get to that a little bit more in the next cause. But what are some things that can compress the plantar nerves and give you numbness in your toes? Well, if you wear shoes that are too tight, it can compress your toes, or specifically the metatarsals, this part of the foot, together, and you can get something known as a Morton's neuroma. That's essentially where the medial and lateral plantar nerve combine together between the 3rd and the 4th metatarsals, and it can cause an irritation where it'll cause some numbness in your toes. Additionally, you can compress the plantar nerves if the arch of your foot drops down. That there are several bones that make up the arch of your foot, and there are 2 bones that commonly drop down if you flatten your foot out, either from overpronation or calves that are too stiff, and those can compress the medial plantar nerve. You also have a bone on the outer side of your foot that can drop down from flattening your foot out too much or overpronating, and that can compress the lateral plantar nerve. Now, the medial plantar nerve supplies the inner toes on the foot. The lateral plantar nerve supplies the outer toes on the foot. So wearing arch supports, insoles, or orthotics, depending on how severe your arch problem is, you may be able to get away with over-the-counter insoles, or you may need a custom orthotic. And if you're in St. Louis and you do need a custom orthotic, we'd be happy to fit you one at More for Life. Just feel free to reach out and we'll help you figure out what's causing the numbness in your toes as well as get you an orthotic. But additionally, you want to make sure that you're stretching your calves and that you're wearing the right type of shoes so that your foot doesn't overpronate, doesn't flatten out too much, and doesn't compress those plantar nerves in the foot. Now, what's the next thing that can cause numbness in your toes? Well, the medial and the lateral plantar nerve, they're both branches of the tibial nerve. And the tibial nerve runs down the back of your leg and wraps around the inner side of the ankle and splits into the medial and the lateral plantar nerve. So both of those are branches of the tibial nerve. Now, the tibial nerve can often get irritated on the inner side of the ankle, and again, largely that's from overpronation. And that it has a name, it's called tarsal tunnel syndrome. So the same things that help plantar nerve problems often help tarsal tunnel syndrome as well. Wearing supportive shoes, arch supports or orthotics if you need them, stretching your calves, and also making sure that the muscles in your hip aren't too weak. That the hip abductor muscles on the outside of your hip, as well as the hip rotator muscles, they also control how well you balance your body over your foot. And if those aren't strong enough, then they can cause your foot to flatten out and compress either the plantar nerves or the tibial nerve at the tarsal tunnel. Now, moving up from there, the tibial nerve is a branch of the sciatic nerve. And that's a nerve that comes out of your butt and runs down the back of your thigh before splitting into the tibial nerve, and the fibular nerve is the other branch. So the sciatic nerve can be irritated at your hip. There's a muscle that it runs underneath that gets a lot of bad press. It's called the piriformis, and that's one cause of sciatic nerve compression. If the piriformis is too stiff, it can compress the sciatic nerve. But additionally, if your hip muscles are too weak, like I mentioned before, it can cause a pelvic drop when you're walking, where you'll kind of drop down like that, and you'll stretch that piriformis over the sciatic nerve over and over and over again every time you take a step, and that too can cause compression. So you can get compression of your sciatic nerve if your piriformis is too short and stiff, or if it's overly lengthened, overly stretched because your hip muscles are too weak. So either one of those can cause compression of your sciatic nerve, which again can cause some numbness in your toes, as well as symptoms like pain in your leg or burning in your leg. Usually numbness in your toes isn't the only symptom of a sciatic nerve problem. It usually comes along with other things. Now, there are other things that can cause compression of your sciatic nerve as well. For example, if you just happen to sit like on one side, if you tend to sit asymmetrically, and you do that over a long period of time, that asymmetrical pressure on your sciatic nerve can cause a compression. Additionally, sitting on surfaces that are too hard, like sitting on bleachers or things like that, can give you some compression of your sciatic nerve as well. Now, what makes up the sciatic nerve? The sciatic nerve is made from the nerve roots of the lower back. And those are largely the L4, L5, S1, and S2 nerves in your lower back that make up the sciatic nerve. And then they go down into the tibial nerve and into the plantar nerves in your foot. So how do you address the problem with the nerve roots in your lower back? Well, that depends really on what the cause of it is. There are lots of things that can compress or irritate nerve roots in the lower back. It can be from a herniated disc. It can be from a degenerative disc. It can be just from sitting with poor posture or slouching too much, or it can be caused by sitting with excessively good posture where you're arched too much. So you have to determine the individual cause of what's pinching your nerves in your lower back. There's no one blanket recommendation for pinched nerves in the lower back. So I don't want to give you too much information on that and give you something that's wrong. But largely, if you have too rounded of a lower back, you want to have a little less rounding. If you have too straight or too arched of a lower back, you want to round a little bit more. So there's a happy medium for everything, and you want to try to achieve that. Now, treating back pain and treating pinched nerves in your back is a little bit beyond the scope of this video. I've got several others that address back pain and sciatica, and you can feel free to check out our channel or check out our blog at More for Life to learn more about that. But if you happen to be listening from St. Louis and you need some help to figure out what's causing the numbness in your toes, whether it be from diabetes or whether it be from a plantar nerve problem or a tibial nerve problem or a sciatic problem or a lower back problem. We'd be happy to help you out. We'll get you in for a one-on-one consultation, help you figure out what's causing your symptoms, as well as what you can do to treat the numbness in your toes and any other symptoms you may be having along with that. Now, if you're watching this from somewhere else, but this helped you to get a little bit more clarity on what's causing the numbness in your toes, leave a comment below as to what you learned and subscribe to our channel so you can get notified of our future videos. Thanks so much for watching and have a great day.